In this lecture, we will discuss about the Calot's triangle. It is also known as Hepatobiliary Triangle. What is Calot's triangle? Calot's triangle, also known as the Hepatobiliary Triangle, is a key anatomical landmark in the gallbladder and biliary surgery. It is essential for identifying structures during cholecystectomy and avoiding complications. What is location of Calot's triangle? It is found in the right upper quadrant of the abdomen. Anatomical boundaries of Calot's triangle. It has three borders. Medial border is formed by common hepatic duct. Lateral border is formed by cystic duct. Superior border is formed by inferior surface of the liver. Calot's triangle has two main contents. Cystic artery is the key structure in Calot's triangle. This triangle also has lymph nodes, known as Calot's lymph node. What is clinical significance of Calot's triangle? Its precise identification minimizes injury to the bile ducts and blood vessels. Understanding Calot's triangle is fundamental for safe gallbladder surgery.